Well, joining us now, we have a remarkable guest, a nun and doctor who, at 85 years young, is still seeing patients amid this crisis through telemedicine. Sister Katherine Seibert, welcome to the fight. We're glad to have you here.
Thank you. Thank you. Here I am at Double Domer. I got my master's there and doctorate at Notre Dame.
Go Irish. Well, you've talked about medicine as a calling. What is it that makes you feel called to it?
Well, it's a gift. God gives us all gifts, and you respond. You sort of harvest the gift and respond and bring it back to God. You harvest it, and it's tough times though to use your gifts. In this pandemic, it is tough.
Sister, I'm sorry. Go ahead.
You have to share your hope and really share the suffering of others, but you have to give them hope and share their suffering as if it's your own suffering, And,
how does your role as a nun impact your practice as a doctor and vice versa?
Well, I guess it's all part of the same call, that call to religious life, that you try to live the gospel seriously. And I often think of Matthew 10:8, the gift you have received, give it back as a gift. So all the gifts that I've received, like from my Notre Dame education to the gift of being called to be a physician, and the gift to be alive at 85 and, still trying to help people is a great gift. So you take the gifts and you try to bring a peace and hope and comfort and healing to the people that you're with. Both the staff, it's tough. It's tough doing what we're doing right now. And to see people who've come in for the tests and a few days later are dead, it's tough. And to help them. And so at this point, there's so much risk that they actually close the office. I'm working in an outpatient office, and we're calling the patients to take care of their diabetes and other problems and just seeing the ones that need to be seen.
Okay.
So that's what we're doing.
Since we're talking about the pandemic, tell us about more of the effects of COVID-19 in the community that you serve.
People are very frightened, and I work with on the whole, I work with poor people, and some are undocumented, and so they have no insurance, and so when they have no job, they have no money, and they have no food. And others are poor and have lost their job, and but they can file for unemployment. But people are frightened. They're doing the best they can. They're dependent, very dependent on the church and other groups for food. And some of them have moved in with relatives, so the family structure is very chaotic. What's very frightening, we've seen a number of people who had the virus with all the symptoms of fever and shortness of breath in late March. And they just came back like this week to have a test because their employer said, now that you're feeling better, if your test is negative, you can come back to work. And their test is still positive, and yet they're feeling better. So I'm also a microbiologist. I got my doctorate at Notre Dame, and I actually work with Tony Fauci for part of my education at NIH. But I think there's a lot about this virus we don't know. So now we have people who have survived the acute symptoms, but they still have the virus. And so that's a problem. They want to go to work, they can't work, and also social distancing is hard to practice for months, especially in a family situation.
It is. So how has the telehealth model, Sister, impacted the way you practice medicine?
I'm sorry, how is what matter?
How has the telemedicine affected the way you practice medicine?
to tell you the truth, it's better than nothing. But I guess I'm old school. I like to see the patient and examine the patient and listen to their heart. But I'm surprised at how happy people are to hear your voice. We can call them or we can video. Most of them just want the call. And they're happy to hear from you because they're frightened, But I think it's quite limited. You don't know even their vital signs, and we can't do labs as often because they have to go out to a lab, and they don't want to go out, and they don't have the money. And, it's better than nothing, But there's a lot to be desired, I think.
I'm sure.
But people are frightened, and so you can, give them some hope, and comfort, and try to be as healing and supportive as you can.
All right. Thank you, Sister Katherine, for all you are doing to serve those in need. I know they appreciate it, and we appreciate hearing about it. Thanks again.
Yeah. Okay. God bless. But I'm not on the front line. But I appreciate all they're doing.
I'd say you're doing your part. Thank you, Sister.